Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for speaking with us again.
Well, thank you very much for having me in the program.
You're welcome, sir.
It's over a week since the Ministry of Health, in collaboration with the Ministry of Education, launched its adolescent COVID-19 vaccination campaign in Region 4. Now, Health Minister Dr. Anthony has confirmed the campaign reaching Regions 3, 6 and 9.
And the rollout has been pretty good. We started out in Region 4. We have moved into Region 3. We also did some vaccination yesterday in Region 9. And today we are going to be in Region 6. So we are also at the same time training the staff within the region to be able to administer these vaccines. So the first 2 weeks, it's both doing vaccination and it's a learning process for the staff within the region, because we have staff that went up centrally to train and as well as supervise the vaccination. A lot of the staff who have now been trained would be able to roll out that independently. So we'll see much more uptake as the weeks go by.
The Health Minister commended those parents who have brought their children to get vaccinated and is encouraging others to do the same so that children can return to school safely. On Friday's COVID-19 update, Minister Anthony also addressed rising COVID-19 cases in some regions.
We have been saying it repeatedly for the last couple of weeks that if we are in a Delta surge, the Delta variant is more infectious. It means that it would be transmitting faster. So for every one person that is infected with the variant, the possibility is that they can infect about 9 others. So unless people are taking precautions, then what we'll see is that we'll see more and more people becoming infected. We have already started seeing climb in the cases. Today we have had close to 161 cases, new cases, which means that we now have 2,052 active cases across the country. Right now, we've had 6,020 children who would have received their first dose of the Pfizer vaccine. And yesterday alone in Region 3, and some that we started in Region 9, we would have completed, just for yesterday, 1,658 doses. As of yesterday, we have had 318,569 persons who would have received a first dose of the vaccine. That would be approximately 62.1% of our adult population. And we've had 166,763 persons who would have received a second dose of the vaccine. That's at 32.5% of our adult population. This is a topic where there have been a lot of discussions, and while some people would get infected and recover and have some level of natural immunity, there's still a debate on how long that natural immunity would last. Some of the scientists believe that if we use the vaccine to stimulate immunity, that the vaccine-induced immunity would be one that lasts longer. And therefore, this is the rationale why we should get people to be vaccinated. It also preps the body that if it encounters the infection, that the body is already primed to make the antibodies that would fight off the virus and therefore you will get a very mild form of the disease. But if you don't have that prep, then your body would have to go through the process of identifying the virus, figuring out that this is coronavirus, then start making antibodies. And during that period, you can have serious difficulty. You can end up in the hospital and you can get, some people would even die, especially those who are older, those with comorbidities and so forth. And we have seen that in the unvaccinated population here in Guyana.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honourable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course our social media platforms.